Okay, so we would start out by donning gloves and washing hands, putting on any other personal protective equipment that needed. My name is Kristen Buck. I'm going to be the nurse educator student today doing your assessment, okay? Okay, so we will start with your olfactory smell. So, what do you smell?
Spearmint.
Okay, and?
Bubblegum.
Alright.
Spearmint.
And?
Bubblegum.
Okay, so that was cranial nerve 1. If you will look at the vision chart. And read.
LTFPH.
All right.
LTFPH.
All right. Both eyes.
LTFPH.
Okay, so that is 20/20 vision, and that is cranial nerve 2 optical. So we're going to do cranial nerve 3, 4, and 6, if you will follow my finger. This is trochlear, oculomotor, and abducens. And tell me when it gets blurry.
It's blurry.
All right. So now we're going to do the cranial nerve 5 or trochlear. Okay. Tell me when. You ready?
Yeah. Now.
Okay. So then we are going to have her do your jaw, jaw, jaw. Okay. So that right there is cranial nerve 5. And it was the trigeminal, not trochlear. Trochlear is the one that we had already tested. Now will you flack your teeth for me? Smile, frown, eyebrows up, eyebrows down, eyes closed, eyes open. Okay, so that was cranial nerve 7 or the facial nerve. Now we will move on to cranial nerve 8 or the acoustic. All right, so you're gonna repeat after me, okay?
Father. Purple. Orange. Mother.
Okay, so now that we've done both of those, let's do the, if you would, open your mouth for me, and and tongue side to side. Okay, so whenever we do the that is doing the glossopharyngeal and the vagal, or cranial nerves 9 and 10. And then we do the tongue side to side is the hypoglossal, and then we're going to do the spinal accessory and arm up and side and side. Okay, spinal accessory is normal and strength is as expected. When looking at back, the shoulders are symmetrical, back muscles are symmetrical. Okay, you'll turn and stand up for me and bend for me. Okay, you can sit back down. Okay, so, and was any of that tender? Okay, so when looking at the spinal muscles and the upper back, no tenderness noted, no asymmetry noted, no issues noted, no muscle spasms noted, no abnormal positionings noted. When looking at the thoracic or lumbar spine, no lumbosacral or thoracic kyphosis noted. When looking from the C7 to the gluteal cleft, there's no scoliosis noted. And looking at the alignment of the shoulders and iliac crest, they are symmetrical and no issues noted. Upon palpation, of the spinous process. Again, no tenderness noted. There's no tenderness noted with the cervical faceta, the sacroiliac joints, or the paraventricular muscle. And if you would, could you do your head side to side, side, side. Now turn, shake yes, shake no, and do a circle for me. Okay, now can you do side, side, and down, and up, and do back. Okay, so range of motion of the neck and thoracic and lumbar spine, flexion, extension, every part of that, every aspect of that is done. Let me see your, all right. So upon doing the physical feeling inspection and palpation of the upper and lower extremities, they are symmetrical. There's no swelling, no deformities, no issues noted. There's no like muscles or tendons that are enlarged. There's no bony landmarks or bony enlargements noted. Okay, so we're going to start having you do your shoulder movements. So can you reach above your head and down? Okay, flexion and extension are good, good. Can you go in like this? Okay. And can you do a 90-degree angle with your arms? Okay. And can you scratch your back for me? Okay, so internal and external rotation are good. Abduction is good, and adduction is good. So then we had her do her elbows. She was able to do the extension and flexion. And can you do your arms out again and rotate with your elbows? Okay. So she's able to rotate like that. Now can you rotate with just your wrist? Okay. All right. Now can you do this for me? Spread your fingers for me. This fingers. And can you touch your thumb to all? Okay. All right. So able to do with wrist, thumb, and fingers, the flexion and extension, abduction and adduction. If you would pull your sleeves up for me. Okay, so do you feel this?
No. Push hard. There.
All right. So
Hard. Hard. Soft. Soft. Hard. Hard. Soft. Soft.
okay. So if you would, let me. Okay. All right. So now let's have you pull, push, and push with your hands. Pull with your hands. All right. Squeeze. Thumb up. Don't go around. Thumb up, thumb down, and finger spread. Okay. So let's see if I can think of anything else. Now we need to do, if you could, can you do finger to nose? Or stretch out, nose, stretch out, nose. Okay, now rapidly together. Okay, so coordination of lower or upper extremities are intact, no issues noted. No sharp, able to tell the difference between sharpness and dullness, and able to move muscles, and no issues noted with the reflexes. All right, so relax. Okay, push against, pull, push against, pull, push against, pull, push, or pull up, push down. All right, and does this hurt? This is hurt. Okay. Let me. All right. So I'm gonna pull your pants up, and again, I would do this over the entire leg, but I don't have it. Can you feel that? All right.
What am I supposed to say? Hard, off hard. Hard, out. Hard, hard. Soft, 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 soft.
Okay.
Hold my hands.
All right. So coordination of movements are smooth, no issues noted. And let me borrow your arm. Any issues?
Mm-mm.
Okay. Okay, so now we're gonna monitor your gaze. Can you stand up and walk away from me? Okay. Gait is smooth. Can you walk on your tiptoes? Smooth. And heels.
Hand.
Smooth. All right, hop in one place. Okay. And again, smooth. No issues noted. Now, if you would, put your legs together. Eyes closed. And stand in spot. Okay, now spread your arms out like you would do in an airplane and leave your eyes closed. Okay, so no issues noted. You may sit down. Okay, so when I was observing her sitting, there was slight where she was kind of slouching. She did not have any tremors or tics whenever she was doing her range of motion, and I was watching that. Whenever I felt of her arms and legs, the muscle size was symmetrical. There was no atrophy noted, and whenever I did the passive stretches, she reported no pain, no issues, nothing that would have had anything that wrong with her. It's like her grip was at her elbows, her wrist, her grip strength, her fingers, and her thumb were all 5 out of 5 on muscle strength, no issues. Her hips, her knees, her ankles, and her feet. No issues noted. 5 out of 5 on strength. I think that is everything on that. It's like we did the light touch on both areas. I did that. Yeah, I think that's everything. Okay, so I did you saw the triceps, the biceps, the um, arm, knee jerk, and the plantar. So let's move on to abdomen. Lay on the bed.
No.
Oh. Okay, so this right here I would do looking like this above and then this below. There's slight rounding but mainly flat. The abdomen is symmetrical with no issues noted. And stop looking at me like that. Okay, there is striatum noted whenever the shirt is pulled up. No scars, no lesions, no rash, and no veins. There's no swelling of the umbilicus, and there is no issues noted with the aortic or peristalsis. I think peristalsis, right? Okay, peristalsis noted. Uh, I will pay closer attention after doing the consultation. Okay, bowel sounds are active in all four quadrants. And okay, so I did not hear. I did not hear any issues around the spleen. I heard the dullness to palpate the liver. I'm going to do a light palpation, okay? All right. She's not retracting away from me. No issues. No jerks. No ticks. Nothing showing pain. Any pain? Okay, so I'm going to do this deeper. Okay, I palpate the liver at 4 centimeters, and I cannot feel the spleen. Okay, so no issues noted. So now I move on to the male genitalia. For the male genitalia, you would start with the adolescent male. Um, for an adolescent male, you're looking at Tanner stage, which is a different stage than for adults. For for everyone else, you're going to be looking at for like lesions on in the skin. You're going to be looking at the penis. You're going to be looking at the glands. You're going to be looking at the scrotum, all of them for lesions. You're going to be looking in hair for any type of infestation because you can't get lice down there. You're going to be looking for, again, deformities. If the penis has any deformities, you're going to be looking at that. You're going to be looking at the prepuce for phimosis, having the patient retract. Um, you're going to be looking at the glands for inflammation. You're going to be looking at the meatus for discharge or lesions. And then the scrotum, you're going to be looking for like I guess, you're going to be looking at the skin and kind of size and shape. I guess that would be what contour. Um, the not inguinal nodes, you'll be looking at like size and consistency. There's a lot of looking for tenderness in such as the penis, the epididymis, um, and cords, all looking for tenderness. You're going to be looking at the testes for tenderness. Um, you're going to be looking for nodules or masses, again, penis, scrotum, testes, cords, epididymis, basically anything you're looking at, you are looking for any type of mass, any nodules, noting the shape and size of those. Let me see. You'll palpate testes between like your two first fingers and your thumb. Um, you'll be looking at sizes, shape of the testes, the external inguinal ring. You would be using your index finger for whichever side you're looking at. You're going to use that index finger and have the patient like cough. For the internal, you will have like slowly advance your finger and have the patient cough. Um, Females, oh wait, I forgot on the males. Before you begin any of that, don't gloves. With the females, again, put on gloves. You're going to have them laying down so that you can separate the labia to be able to view the like perineum, the clitoris, the urethra meatus, the labial minora and majora, and the pubis. You'll be looking for swelling, lesions, discharge, masses, erythema. The labial area, if you it has when it has swelling, it's you would look for Bartholian glands um, because they cannot be felt or seen normally. Then you would move to the next part, and this is the spucal exam. You want to make sure it's warm. You want to make sure to warm your patient before you move on to the next part. And you want to make sure it's inserted correctly. You're going to be using a downward pressure to ensure that you're going in at a slight angle with the downward pressure and ensuring that you can view the cervix. So you would open the sputum slowly so you can view the cervix for color or lesions. You would be looking at the cervical area for shape, discharge, bruising. Again, I think I mentioned lesions whenever I said cervix. Then you would move on to the pap smear. The pap smear, you would do an endo cervical and or ecto, yeah, ecto cervical or endocervical specimen. Before you do any other diagnostic test, then you do the other diagnostic test and the wet prep specimen if you had to. And then, of course, as you are removing the speculum, you would be looking at the vaginal mucosa for inflammation, discharge, color, masses. Then you would be doing the exam through palpation. You'd be assessing the vaginal wall and asking the patient to bear down, looking for nodularities, muscle tone, tenderness. Um, it's like whenever you're looking at the vaginal wall, you're also looking at the introitus. Yeah, introitus. You're looking, again, muscle tone, tenderness. You're looking at the cervix for any mobility, position, consistency, tenderness, masses. You're looking at uterus, the adnexa, and the rectovaginal. Again, tenderness, masses, mobility, consistency, shape, position. You're looking at the ovary, or you're feeling the ovaries. Let's see, yeah, that's all in the female. The rectal exam, you would, again, put on equipment, your protective equipment. You would ensure that if you had a female, you would leave them in the position they are in. If you've already been doing an exam down there, you would have them either bend over or on their left side on a table. You're going to make sure they understand the steps. You are going to be looking for lesions, ulcers, inflammation, rashes upon inspection of the rectal area. For the area of the next area you do with palpation, and you're going to be doing that in the anal canal. You're going to be reassuring the patient. You're going to be lubricating your finger, asking the patient to bear down so that you can be looking for lesions um, before you even start inserting anything. You're going to be inserting fingers whenever the sphincter is relaxed, and you're going to be feeling for like the sphincter, like tone, nodules, irregulations, and you're going to be like aiming for the umbilicus, and just feeling that as after you put your finger into the canal, you're going to be advancing into the rectum. For women, you're just going to go clockwise and counterclockwise to feel bilateral and posterior, looking for irregularities or nodules. For a male, you're going to be feeling of the prostate, feeling of the size, shape, not for nodules, tenderness, and you're going to be warning your patient about feeling a need to urinate. And then you will, upon removal of finger, if there is any fecal matter, you're going to be testing for oculate blood. Let's see. That's everything. Thank you.